local and live. Covering Franklin and Washington counties, it's Let's Talk TriState.
Welcome to Let's Talk TriState, all powered by HomeRight Windows and Doors in Waynesboro. The right choice, online at homerightwaynesboro.com. Joining us today, we have Dr. Umar Razzaq. Am I pronouncing that correctly, Doc?
Yes, you are.
And you are a primary care provider with our good friends at Wellspan Health. Is that correct?
That's correct, yes.
Okay. So you're in our area. You are at Wellspan Family Medicine in Greencastle. But as we do with all of our providers on our Ask the Expert segments, take us through your history, Dr. Razzaq, if you would.
So I grew up in Connecticut, and then I did my medical school in West Virginia at WVSOM, which is an osteopathic medical school. And then I did my residency at Holzer Health System in Ohio. And then I ended up here because my brother is close by in D.C. and family is close by as well. So
family is very important. You practice family medicine, so that's very fitting. Dr. Razzaq, many of us are wondering, is sick season finally over this time of year? And should we be concerned about the cold, flu, illness, sick season?
So while we might have fewer viruses, sick season isn't truly over. Sicknesses can occur at any time of the year. As we move through spring and late summer, seasonal allergies become more common. However, no matter what kind of health concerns you might have, Wellspan is a very good choice for treatment options.
Absolutely. Now, I know many of us suffer from seasonal allergies, and that can sometimes lead to other issues such as sinus issues. So when do we know, when it comes to seasonal allergies, what would we be experiencing that might make us say, you know what, I may need to see a provider?
So there are many treatment options for seasonal allergies. The first step is like over-the-counter medications like antihistamines, nasal sprays. You can also try taking vitamin D and C to keep your immune system strong and healthy, staying hydrated. However, if your symptoms do persist, you have many options through Wellspan. You can schedule a video visit with your primary care provider. You can go in person to discuss this with them further, or you can go to the urgent care after hours if needed.
Wonderful. Now, what are some of the common summer illnesses and injuries? And I think the better question would be, along with that, is where can we get care for them?
So some of the common conditions we do see is like swimmer's ear, where you have water that's remaining in the ear canal, and this can cause itching, pain, and discharge, and it's very common in children. Mm-hmm. Sunburns can also happen when there's overexposure to the sun without proper protection. And this can cause skin irritation. Treatments usually include like moisturizers, pain-relieving ointments, and other over-the-counter medications. And then tick bites are also very common as people explore the outdoors. Lyme's disease is a common concern we see from a lot of our patients. But these can all be addressed by your primary care provider, or as I mentioned before, you can go to urgent care or through our virtual visits.
And I'm glad you ended with virtual visits. You're speaking about virtual visits, which is essentially kind of what we're doing now, minus the medical component in any official capacity. But take us through a virtual visit. Here are the questions that I would have as far as that goes. Every time I've ever gone to a doctor's office, it's the same thing. Vitals, weight, height, and then you have the component of the doctor asking you what it is that's actually going on. That part I understand being taken care of virtually. Are there restrictions when it comes to the virtual visits?
Yeah, so for virtual visits, just like we're doing here, is basically like through audiovisual component, and we have dedicated providers. It's just like any type of office visit during the typical hours of operation, and you can schedule an appointment with either your regular doctor online or with another primary care doctor if your doctor is not available. And these visits are useful for conditions such as, like allergies, sinusitis, minor aches and pains, where physical examination is not always necessary to do. Right. However, if you obviously have, further complications after the virtual visit, you can always come in person to get it checked out further. Okay, that's wonderful. Now, is Wellspan, more specifically you, we're speaking with you, but is Wellspan currently accepting new patients? I know a lot of what I hear is, oh, we're not accepting new patients. Sorry, we're full. I myself am in the market for a new primary care physician. So is Wellspan accepting new patients? Yes, we are. Wonderful. So we're accepting patients for of all ages. So particularly in Greencastle and in Fayetteville, we have family medicine and internal medicine, which are both accepting patients. And you can find contact information and a link to schedule an appointment on our website at wellspan.org/getcarenow.
And then the follow-up question to that I would have, Doctor, is
Sure.
What is it the concept of changing doctors? And if you don't have a doctor, that it's just as simple as making the phone call, setting up an appointment, and going and seeing you, Dr. Razzaq, as example. But if you're changing doctors, it's not really, especially in this day and age, as scary a concept as people think, is it?
Yes, no, it's not. So, the difference between primary care, primary care is all pretty much the same. Family physicians treat patients from like toddlers, infants, all the way to seniors. And then internal medicine mainly focuses on adult patients. But any provider within primary care, they pretty much all have similar training.
Okay, and you answered my next question. That's great. How about this one? But thank you for sharing all the ways that you can manage some of the common seasonal conditions. But where can patients go to learn more, find a location close to home? I know you've covered the website. We have the link, obviously, that's going to be that'll be up on the screen here. But
Yes.
where can they go once again, Doctor?
So it will be at wellspan.org/getcarenow.
Okay.
Or you can even go on Google and just kind of search Wellspan, and it'll have a website that pops up, and you can search for a provider there.
Doctor, as we always do on Ask the Expert, I love speaking with our doctors and physicians such as yourself. It's always an honor that you take the time. I know you're very busy, and you have, I'm sure you have a docket full of patients that you need to see today. Your schedule's chock full. So we thank you so much for taking the time out and visiting with us here on Let's Talk TriState, and hopefully we will speak to you again, Doctor.
Yes, hopefully. Thank you very much for this opportunity.
All right.
Thank you.
And thank you for joining us on Let's Talk TriState.
Let's talk TriState.
If you'd like to be featured on an upcoming episode of Let's Talk TriState, call 717-597-9200 or email letstalk@921thegoat.com.